Recording in progress.
Welcome to today's webinar hosted by eLotus. We are proud to be your source for quality CEU content, having provided educational courses for over 2 decades. Our goal is to help you elevate your knowledge and expand your skill set. With over 250 speakers, 900 courses, and a staggering 3,500 hours of continuing education, we are committed to providing you with the best educational experience possible. I'm Donna Chow, your host and moderator for this session, and I'm thrilled to be guiding you through this session. Today's class is sponsored by Evergreen Herbs. The class is the anti-inflammatory effect of Chinese herbs, presented by the esteemed Dr. John Chen, who is a recognized authority in both Western pharmacology and Chinese herbal medicine. He's the leading author for the Chinese medical herbology and pharmacology, Chinese herbal formulas and applications, and Chinese herbal formulas and veterinarians books. He's also the herbal consultant for Evergreen Herbs, where you can reach him by email to ask him questions on potential herb-drug interactions for your patients. His contact information is in your lecture notes and more information about the herbs as well. Dr. Chen will share today what you can find in his books and can be also purchased at evherbs.com. To find past webinars presented by Dr. Chen and also earn CEUs, you can find that on elotus.org. The class will run from 10 a.m. to 1 p.m. Pacific time with 1 break. Before we get started, let me highlight some important Zoom features. First, we have the chat room. It's an excellent tool to connect with your fellow colleagues, and I encourage you to set your chat preference to everyone to make it inclusive. Second, the Q&A box is where you can ask questions for the speaker. Please limit your questions to relevant topics to keep the session organized and efficient. Lastly, for those who qualify, the CEU quiz will be available the following workday, and I'll send you an email when it's ready. Okay, let's go ahead and get started, and welcome Dr. Chen.
All right, let's do a quick audio and video check first. So those of you who are listening to this class, please type in the chat whether you can hear me and see me okay before we start today's class. Okay, so hang on just 1 second. Okay, so is the audio and video both good? All right, great. All right, welcome everyone. It's great to be with you again today. Our topic today is going to be the anti-inflammatory effect of Chinese herbs. And before I start today's class, Okay. Today's class is actually the third of a three-part class on COVID-19 and TCM. Obviously, we did the COVID-19 past, present, and future already, and I think that was done late last year or early this year. And COVID-19 at this point is no longer a global pandemic. In fact, I believe WHO has officially ended the pandemic status. But nonetheless, it was a great lesson for all of us to learn from. So next time, when this happens again, we will be much better prepared. And some of the lesson that we should learn from this is the global pandemic. This is certainly not the first time and certainly won't be the last. So the next time another infection like this happen again, one of the first things we need to learn is that there are a lot of Chinese herbs who in fact have excellent antibiotic effect. So both antibacterial and also antiviral. So we definitely need to know which one those are so we can get the best effect to treat the infection itself. Okay, then the other is the complication of the infection, and that will be the inflammation. Because as the bacteria and virus attack different parts of the body, they're going to trigger an inflammatory response. Okay, so in most cases, that's healthy. But in some cases, the inflammatory process gets out of hand, or the immune system becomes hyper-responsive and cause cytokine storm or trigger subsequent autoimmune disease later on. So we also need to learn what are some of the herbs we can use to treat the inflammatory response by the body. Okay, so that will be the topic today. What are some of the herbs that have such anti-inflammatory effect? All right. In today's class, we will mostly talk about herbs that have anti-inflammatory effect to treat inflammation of the organs. Okay, so whether that's the lung, the skin, the nose, and so on. When the term anti-inflammatory is used, a lot of time it also refers to pain management. Such as patient with inflammation of the joint, arthritis or muscles, and so on. So from that perspective, you have drugs such as ibuprofen, naproxen, Voltaren, and so on. So that's a separate topic, that's a separate class. If you're interested in the pain management and the anti-inflammatory effect of Chinese herb to treat pain, I have done some classes on that in the past. So if you're interested, here are two of the topics and the links for those classes. But like I mentioned today, we will mostly talk about anti-inflammatory effect as it pertains inflammation of the internal organs. All right, so with that, let's go ahead and get started. All right, so a lot of people think of pain and inflammation as if they are bad things. And the first thing I want to say is that's not necessarily the case. And the reason is because pain and inflammation is a normal body response. And in fact, they are supposed to act as a warning sign to tell us that something is wrong with the body. So when you first have a headache or first have a stomach pain, or maybe you sprain your ankle, and then it shows pain and inflammation, it's supposed to tell you that something is wrong to take care of it. That way, a small problem doesn't turn into a medium problem, and a medium problem doesn't turn into a big problem. All right, so pain and inflammation are both supposed to be positive warning signs. But every once in a while, the inflammation can get out of hand. Okay, so as we mentioned in all the previous COVID classes, the inflammation can get out of hand in terms of leading to cytokine storm, or the immune system can become so hyperly responsive that subsequently it triggers autoimmune disease. All right, so there is healthy inflammation and there's also unhealthy and abnormal inflammation. But inflammation, why does it occur? Why is it necessary? So imagine, if you would, you suffer from something. Okay, that something could be trauma, could be injury, or it could be some type of external stimulus. All right, so it could be the bacteria, the virus, the endotoxin, the stress, tumor, ultraviolet ray, whatever it may be. So now you have some type of cause that triggers the need for the body to repair it. All right, so this cause may be somewhere in your head, in your lung, in your ankle, in your liver, some part in your body. So the cells in your body needs to get to the disease area in order to fix a problem. And the way it does that is these trauma, injury, and stimulus will first cause the body to reduce substance called the histamine, leukotriene, and prostaglandins. And what these compounds will do is they will act on the blood vessel to cause vasodilation. So now the blood vessel will dilate, will open up pores for the cells to come out and take care of the problem. Okay, but along with the dilation of the blood vessel that allows the cell to come out, what you also have is the fluids will also rush out as well. So when the fluids rush out from the blood vessel to the surrounding tissues, obviously this is when we see the swelling and the inflammation. This will cause localized redness, warm sensation, swelling, and as the fluid expands, they press on the nerve ending and therefore also cause pain. All right, so this is part of the defense response to allow the cells to come out, but then during the process, the fluid also comes out. So once again, this quote unquote inflammation is a good thing because it allows the cells such as macrophage, leukocyte, lymphocyte, neutrophils, and so on to come out and take care of the problem, right? So these are the white blood cells that need to go and attack the bacteria and virus to get rid of them. All right, so this part of the inflammation is obviously normal and it's necessary. And then along the line, if the macrophage, leukocyte, and lymphocytes are able to take care of the problem, that may be the end. But sometimes the stimulus may be very specific. So the body needs something in addition to better take care of the problem. So now what happened is the macrophage, lymphocyte, and leukocyte will secrete additional substance to call for additional help. Those additional substances are TNF, which is tumor necrosis factor, IL, which is interleukin, and INF, which is interferon. So these are more specific response that call for help to treat and target specific area. All right. So if all goes well, then the stimulus, the bacteria, the virus is eliminated, is out of the system. And the body has a memory cell that remember what these stimulus look like. And if they were to re-enter the body at some point in the future, they can then quickly recall the response needed in order to treat the same thing. So this is basically when our body develops an immunity to whatever the pathogen is. So this is a memory cell and its function. However, sometimes the problem is not properly resolved. Okay, so what I mean by that is the toxins, whether it's from bacteria, virus, endotoxin, maybe from herbicide or pesticide, maybe some type of vaccination, some type of heavy metal, and so on and so forth. Maybe they are not completely eliminated. They are buried deep inside the fatty tissue, inside the organs, in different parts of the body that are not completely eliminated. So now what happened is the body will then continue to produce tumor necrosis factor, interleukin, interferon, or other pro-inflammatory cytokines to continue to address and try to eliminate these pathogens. And what that means is the body is now in a chronic state where the immune system is always hyperactive. Okay, so this then slowly becomes chronic inflammation, slowly becomes autoimmune disease. So now the immune system is not only attacking the foreign toxins, but a lot of time is also attacking the healthy tissues that may be harboring these foreign toxins. So now imagine, if you will, the immune system attacking maybe the lung, maybe the eyes, maybe the tear duct, maybe the kidney, maybe the skin, and so on. So it will then slowly lead to chronic inflammation, destruction of these tissues, destruction of these organs. And with destruction, the body may try to heal. And then the healing process may lead to fibrosis. Or maybe the body is not really able to heal it. So the destruction will then slowly lead to degradation, to atrophy. And with the damage to the organ, you will also have a loss of function. So overall, basically, the chronic inflammation is the heat and fire. And the heat and fire in TCM long-term will cause insufficiency and Qi deficiency. The insufficiency in this case would correspond with the destruction of the tissues and organs and cells, right? Because in represents substance. and then qi represents function. So once you have damage of the organ, it's not able to perform its normal function. So that's a loss of function in a qi deficiency or qi damage. So this is basically the worst case scenario where the initial problem was not properly taken care of. So the acute inflammation then leads to the chronic inflammation. And the chronic inflammation is then formed, or perhaps an autoimmune disease, where the organ suffers damage and then cannot perform its normal function. All right, so this part of the chronic inflammation is obviously abnormal, and it's what we try to target and end with either drugs in Western medicine or herbs in Chinese medicine. All right, and like I mentioned, this hyperactive immune system and autoimmune disease can attack many different parts of the body. So depending on what organ and what part of the body that's attacked, then in Western medicine, you have different disease name, right? So if it's the skin, it could be dermatitis. It could be, if it's the eyes, it could be conjunctivitis. If it's the nose, it could be right now kidney nephritis, and so on and so forth. Okay, so different parts, many different organs can all be affected by both acute and chronic inflammation. Okay, take the which clear the here. And so you inside so she is you have most of the there tends to be more deficiency heat. All right. And what ends up there are solely there type of some Disease from a TCM perspective usually starts from the exterior, mild, and they gradually become more severe. So we'll find okay, so obviously the best treatment is no treatment at all, and that means if at all possible. But if you are exposed to it already, then the next best thing is to help to treat the patient symptomatically. So one of the most effective formula is called 消风. The allow to given exposure body starts budget everywhere. In blood the problem in with to some treat the he herb. This is a formula. These are many herbs that are exterior releasing herbs that also have significant anti-inflammatory, anti-allergic, antipyretic, and also antihistamine effect. Okay, so I was getting a little bit ahead of myself. So primarily that refers to the top 3 herbs, which are Jingjie, Shisenopeta, Fangfeng, Saposnicovia, and also Chantui, Cicada molting. So these are the 3 herbs that together have anti-allergic, antihistamine, antipyretic, and also mast cell stabilizing effect. So once you stabilize a mast cell when it's degranulated, that's when it releases the histamine, and histamine then leads to allergy and leads to itching. All right. So basically these 4 effects, they go hand in hand. Okay. And like we mentioned earlier, this formula is mostly for wind heat at the exterior in the form of eczema, urticaria, rash, and so on and so forth. Okay. So these are the TCM and Western indications. And these are the TCM and Western functions: expel wind from the exterior, clear heat, and dispel dampness. And once again, anti-allergic, antihistamine, and mast cell stabilizing. Okay, so overall, I would say this formula is quite effective to treat the skin allergy. Okay, probably comparable, maybe a little bit weaker compared to the drugs. And the reason I can tell you that is because I do get allergy quite a bit. So sometimes I take 消风散, and sometimes if it's really severe, I do take Claritin sometimes. Okay, so that's my personal take. All right. A lot of people these days also have wind affecting the nose. Okay, so this is part of the allergic response, and this is probably the worst time out of the year as far as seasonal allergy is concerned. I live in Los Angeles, and this year there's a record amount of rain, okay, and snow. And what that means is during springtime, which is just about right now, actually started about 2-3 weeks earlier till now and may last for a few more weeks. The flowers are blooming everywhere. And what then happened is, of course, you have pollens everywhere as well. So the last 2 weeks have been quite bad for me as far as allergy goes. And you can probably still tell I'm, pinching my nose, scratching my nose. because I do have a bad allergy, and my voice is probably a little bit nasal as well. So despite the herbs that I do take, unfortunately, the pollens are in the air and there's really no escaping it. While I mentioned earlier that the best treatment is no treatment, is to avoid the allergen as much as possible. But unfortunately, in this case, allergen is in the air. So despite all the herbs that I take, despite the change of air filters, you go in and out of the house, you go somewhere, and you're just going to get exposed to it. So so you just do the best you can. So anyways, these are the 4 primary formulas for patients that have sinusitis, rhinitis, sneezing, basically seasonal allergies, pollen allergies, things that are in the air. Okay, so that's the wind, right? So Xinisan, magnolia flower powder, is more for the wind or the wind cold. So in this case, patients tend to sneeze quite a bit. They have some aversion to wind. And if they blow their nose, generally the nasal discharge is clear and white. Okay, so it's more of a wind or wind cold type of presentation. And then sometimes when the condition lingers, okay, and the infection starts to get worse, inflammation starts to get worse, then the inflammation becomes more of a heat component, right? So at this point, the congestion becomes worse, and the nasal discharge start to turn from white and watery to yellow and more sticky. All right, so this is when you start to have more inflammation. All right, so once again, this now becomes, Xinisan is more of an allergy, and then Chang'ersan more specifically treat the sinusitis and rhinitis. So there's more of an inflammatory condition. And you can also tell from the Western disease name, itis, right, itis, in Latin means inflammation. So whenever you have dermatitis, which is the inflammation of the skin, or sinusitis or rhinitis, which is inflammation of the sinus cavities or the nose, right? So there's more heat involved. So Chang'er is more specific for wind heat. Okay, so like the condition I described earlier. And then Qing Bi Tang is more of a contemporary formula. So probably became very popular and very frequently used in the last 50 years or so. So this is a formula that treats stampede in a more severe form compared to Chang'er. So in this case, I would equate it to stampede or maybe sinus infection. Okay, so probably not just allergy turning into inflammation. Maybe there's some bacteria, there's some virus involved. So there's some infection component and inflammation component. So this formula is more bitter, more cold, and stronger compared to the first 3. Okay, and then the last formula is Xin Yi Qing Fei San, or Xin Yi Qing Fei Yin, magnolia decoction to clear the lung. And the best way to think of this formula is this is a formula that treats the nose, which is what Xin Yi is, and also treat the lung. So these are the patients that have allergy of the nose, they have postnasal drip, and then as they don't blow it out, the sinus discharge then drip into the throat and then into the lung. And therefore, what start out as perhaps just an allergy or maybe just mild inflammation, then change to tonsillitis or sore throat, and eventually lung infection. Okay, in fact, this is the main problem my daughter has. My daughter is about 2.5, and she does not know how to blow her nose. So anytime she has runny nose, she's suck it in, and then sometime later it turns into a cough and maybe even turn into a lung infection. All right. So we try to use bulbs as much as we can, but that doesn't get rid of all of it, So so until we can teach her to blow her nose, this is a problem. And then, obviously there are other people that have signed, postnasal drip as well. All right. So these are the 4 formulas that are most effective for treating wind affecting the nose. And one other side note is, as you use herb to treat this problem, one of the things to keep in mind is basically for treating patients, the bottom line is you need to have the medicine to go to the disease area, right? So if you're treating the nose, actually one of the best things you can do is imagine you use the herbs in granules. So you mix the granule with hot water, you stir it up, and initially it may be too hot to drink. So a lot of people just let it sit and cool down. But what happened is while it's cooling down, you have a lot of essential oil that are evaporating and basically being wasted. All right. So instead of it being wasted, what you can do is imagine if this, this is a cup. So you use your hands and you form a little tent on top of the cup. And then while the solution is cooling down, you inhale the steam and you inhale the essential oil right into your nose. So the steam will help to hydrate the nose, and essential oil will help to treat the sinus problem, which is exactly where the disease area is. And then once it cools down, you can then drink the rest of the decoction. So that's one of the ways to get the most out of the herb, both in terms of not wasting anything, and also to maximize delivery of the herb right to the disease area, right? So you have inhalation right into the nose, and then after that, you drink it, it goes to your stomach, you absorb it, and then goes back systemically to the rest of the body and also the nose. All right, so that's one little hint to get the most out of these formulas, whichever one you select to help to treat the patient. All right, so as far as these four formulas goes, the one formula that we will zero in a little bit more is called 苍耳子散. And in this case, both for therapeutic effect and also for the potential side effect that you need to know both. Okay, so this is the composition of 苍耳子散. It has 苍耳子 xanthium fruit, 幸利花 magnolia flower, and then 白子 angelica and 薄荷 mint. Okay, so a relatively simple formula, primarily for nasal obstruction caused by wind. So like I mentioned, wind heat, you can use it for acute or chronic sinusitis or allergic rhinitis. All right. TCM effect is to dispel wind and open the nasal orifice. Western pharmacology is antihistamine, anti-allergic, and also anti-inflammatory effect. And the two primary herbs in this case are 苍耳子 xanthium fruit and 幸利花 magnolia flower, as these two herbs have anti-allergic, antihistamine, and anti-inflammatory effect. All right, so these are the two main herbs, even though they have what sounds like similar effect to the first formula we talked about earlier, which is 消风散. But those herbs target primarily the skin, and these two herbs target primarily the nose. Okay, so once again, like we mentioned earlier, when we have that slide that showed about 100 different herbs with anti-inflammatory effect, you need to know which herb to pick based on the disease area. Okay, so 防风, 荆芥 are more for the skin, 苍耳子, 幸利花 are more for the nose. Okay, and when you do use this formula, what you really need to know is that if you remember back to Bacterial Medica, 苍耳子 is usually designated as slightly toxic. Okay, but unfortunately, what most textbooks don't tell you is that, well, what is it toxic to? Well, what are the adverse reactions? What are the signs and symptoms? And what is the contraindication? And as it turned out, the main contraindication is actually to the liver and also to the kidney. Okay, and what happened is 苍耳子 in its raw and processed form contains toxic proteins that, if consumed at a large amount, can in fact be quite toxic to the liver and also to the kidney. And that's why this herb needs to be dry fried, and like I indicate here, and also in all the classic herbal formula text. And what happened is, as you dry fry it and use high temperature, you need to dry fry it to a point where the spikes on the outside becomes dull or no longer present. And that's an indication that enough heat has been processed to detoxify the herb. And what that does from a chemical level is that the dry frying, the temperature will help to enhance the extraction of the active ingredients, so we can get more out of the herb, and at the same time deactivate the toxic compounds and denature the proteins that are toxic. All right, so dry frying actually does two things. One is to enhance the effect and also decrease the toxicity. Okay, so the details are here in case you're interested, basically to dry fry and so on. And then the toxic compound is the carboxy atractyloside. Okay, so once again, you want to enhance the extraction of active compounds and minimize and destroy the toxic compound, which is this compound over here. Okay, and the reason, once again, is that if you ingest 苍耳子 at a large dose or in processed herb, that can cause liver and kidney damage. Okay, but once it's properly processed, that is no longer a concern. Okay, another thing that's very important is a lot of Westerners love to use tinctures. Okay, so they will make tinctures out of the raw herb and give it to the patient. And one thing I would like to caution you is that make sure you know what you're doing, make sure you do your homework. And the reason is because they are, Chinese herb have roughly about 2,000 or 3,000 years of history through actual trial and error in actual patients. So what happened is 泡制, which is the processing of the herb, is a specific class that you need to take in order to understand basically the organic chemistry of herbs. So what happened is there are a lot of herbs that require alcohol to properly extract the active components. And those are primarily the tonic herbs. And there are some herbs that should not be extracted with alcohol because there are some compounds that are toxic that should only be extracted with water. So the active compounds come out, and ones that are not water soluble, that are alcohol soluble only, they stay behind and are poured out as part of the drags. So 苍耳子 is one of those herbs. 苍耳子 needs to be dry fried and then water extracted. You never want to use alcohol to extract 苍耳子, because then what you will end up extracting is more of the toxic compounds and not the active compounds. Okay, so make sure you follow the traditional description of how the herb should be prepared, because if you deviate from it, then what you end up with is perhaps a completely different product that will not have the same effect or the same side effect profile as what Chinese materia medica describe it to have. All right, so pharmacologically, basically 苍耳子 and 薰衣花, like we mentioned, have anti-allergic and antihistamine effect, and they do it mainly by blocking the histamine release and also stabilize the mast cells. So basically to stop the allergic reaction right at the root, which is the mast cells and degranulation of the mast cells. They also have strong anti-inflammatory effect by blocking the cytokine production, primarily interleukin-4 and interleukin-13, and to suppress the liposaccharide-induced pro-inflammatory factors. So basically, they are equally effective to treat allergy and equally effective to treat severe inflammation. And that's why they are good for the nose, whether there's allergic rhinitis or inflammatory type of sinusitis and rhinitis. Okay, and that's why this formula, these two herbs are so effective, and the formula 七厘散 and also 苍耳子散 are so effective. But like I mentioned, if you do use 苍耳子, make sure it's dry fried, make sure it's water extracted, and not the raw process and not the tincture form. Okay, so I can't stress that enough. That's very important. But if for some reason, okay, the patient has pre-existing liver disease, maybe they accidentally took too much of 苍耳子 or 苍耳子散, then these are the classic description of how you can use herb to treat the overdose of 苍耳子, Xanthium fruit. Okay, you can use 板蓝根 Isatus root at 120 grams, cook in water and give a decoction. You can use a combination of 甘草 licorice 30 grams and 绿豆 mung beans 120 grams. Use it in decoction and give it to the patient. You can use 芦根 绿豆 金银花 葛根 甘草 9 grams, or you can use acupuncture, basically needle, large intestine 11, and also spleen 6. Okay, so these are very useful information that I hope you never have to use. Okay, and this is also something that I feel is very, very important. I've been practicing for about 25-30 years and writing books for about a little bit over 20 years. And one of the things that I always try to do, much like in this class, is to present as balanced information as I possibly can on the pros and cons of Chinese herbs, the effect and also the side effect of Chinese herb. Because Chinese herb is not all safe, all side effect free. There are some herbs that can potentially create side effect. And if anybody is to know this, it has to be the TCM practitioners. You need to know what herb may cause what side effect, what herbs may cause, or what herbs have what contraindications. And if somehow worst case scenario they do occur, we need to know how to take care of it the best we can. So 苍耳子 Xanthium fruit is one of those examples. Knock on wood, I've been in the US, I've been practicing for about 25, 30 years. And I've been doing a lot of consultation to practitioners for the same amount of time. So knock on wood, I'm not aware of one single event of 苍耳子 toxicity here in the United States. So I think overall, we as TCM community have done a great job, in terms of herb company properly processing the herb and TCM practitioners properly identifying the diagnosis and using the herb. So like I said, knock on wood, in the last 25, 30 years, I'm not aware of one single toxicity issue with 苍耳子 or 苍耳子散. Okay, so let's take a 10 minutes break and then we'll come back and continue with 痹症, painful obstruction syndrome.
Recording stopped.